My name is Jesse McIntyre. My presentation is on using the switch model to improve athletic trainer and athletic training student retention and through job satisfaction. Here's the general overview. In general, what I want to do with this is improve job satisfaction and improve work-life balance. So, athletic trainer retention has been in the spotlight since NATA numbers have been dropping. The NATA has been swinging in a way where most of the incoming members are students. So it's generally work-life conflict, burnout, lack of job satisfaction that lead to attrition. And then females are affected to a greater extent because of different responsibilities or different implied responsibilities. So athletic training student retention is also an area of concern. Some numbers are as high as 81%, but it gets better as you go to entry-level master's students. Demanding coursework and extensive time commitment beyond other majors is what generally leads to attrition, and then females are more affected, just like a job placement. So, in the book Switch, the authors outline 3 different domains to affect change. First off, the rider, the elephant, and shaping the path. The rider is generally going to be your rational side, the elephant's more emotional, and then the path is getting them to where they need to be. Okay, there it is. Directing the rider involves rational persuasion. So you're going to try to convince someone using facts and statistics, things of that nature, and showing them the why, showing them kind of how it can be done. So retention has been shown to be a product of rewarding workplace relationships, increased autonomy, and increased social support. So these areas might be considered bright spots where we need to focus on. Retention has been shown to be higher in ELM students, and of course every KD program is transitioning to ELM. So that's going to kind of direct itself. And work-life balance can come from just giving more time away from work, separation from work during that time, and increasing the personal and the professional support networks. So regardless of the direction that the rider wants to go, the elephant still hasn't moved. So you have to encourage the emotional side that there is a purpose to this, that this is what you really want. So, motivating athletic trainer retention can start with just some mindful and caring athletic administration that understands the struggles and will give someone more time off to spend with their family or just to get away from work. So, athletic trainer retention started through small, realistic changes. Generally just spreading coverage around the athletic training staff where you don't have someone working very few and someone working a lot of hours. Changing coverage for some events, maybe not directly covering workouts, camps, things like that. And then, as resources eventually allow, adding staff and normalizing treatment of work hours as much as possible. When the rider has been motivated, or when the rider has been directed, the elephant has been motivated, the next thing that you have to do is shape the path and give them the path to walk on, a nice clear path to the goal. So shaping the path is going to start for the students just by the transition to ELM. That's going to make the path change directly. And then really we need to pay attention that athletic trainers might also resist the change. Desired outcomes are increase in job satisfaction and eventual workforce retention, and then increase in athletic training student retention, job placement, and professional commitment. If we can push the students to stay around more and to understand what the profession is, and they're more likely to stick around in the profession once they get into it. So, for athletic training, if we increase athletic trainer retention, improve patient outcomes, increase general job satisfaction, increase value of the profession, and then also encouraging better athletic trainers to stay in the profession longer. If we increase AT student retention, then we're going to be putting better clinicians out into the workforce, and they're going to have more job commitment or professional commitment when they come out. So here are my references, and thank you.